And I believe somebody is going to call the roll.
Yes, ma'am. Gloria Mills,
Here.
Glenn Brown,
Here.
Craig Purcell,
Yes, I'm here.
David Newell, Emily Hugart,
Good morning, here.
Christina Melling, Beth Pasick,
Yes, I'm here.
Mark Harshbarger, Deborah LaQuinta,
Here.
Dr. Leslie Gordon, Councilman Schisler, Nancy Pacifico, Cassandra Blaylock, Jody Toner,
Here.
Artie Fryer,
Here.
Mike Lacey,
Here.
and Commissioner Smith and John Pelkey are excused absence.
How many do we got total?
I have 9 members present.
Okay, thank you.
Okay. Is there anyone from the public present that wishes to speak for 3 minutes?
Ms. Mills, I
guess-
do not see any public comment.
All right, no public comments. In the next, we're going to ask for not the approval, but any corrections for the October 23rd motion minutes, excuse me. Any corrections, additions? So we're not going to go any further than that, right?
That's correct, Madam Chair.
Okay.
Madam Chair, do we want to let the new member introduce themselves?
Oh, please.
Thank you. My name is Beth Pasick, and I'm with the Department of Children and Families, and I've been in social services for 30 years or more. Currently, I'm the Community Development Administrator here with the Department of Children and Families. And really what that does is the person that really looks at strategic partnerships across all programs within Hillsborough County. So I'm very excited to be a part of the board. Thank you.
Thank you. We're glad to have you. Now we're going to discussion of items, and that will be Joshua, and it's CTC evaluation. Turning it over to him.
Thank you, Madam Chair. I want to confirm if everyone can see my screen.
Yes.
Yeah, I think I
Yes.
All right. Wonderful. Thank you, guys. So I'm here to present our CTC evaluation for this fiscal year. I just want to provide a quick overview of what the CTC evaluation is. It's a required product by the Florida CTD, and we conduct it annually. It evaluates the performance and overall quality of our community transportation coordinators' services. And like I said, we conduct it every year except for the year of the CTC redesignation. That is this year, but in coordination with the CTC, we did decide to conduct a abbreviated evaluation this year. We really wanted to evaluate the impacts of the pandemic on operations and service quality, and just have some consistency across all of our work products. So just to give a bit of an overview of what you'll find in the CTC about this year, it's a little different than previous years. There's a few additional items. We have an overview of the overall coordinated system and program. what TD services are available, what providers are currently providing service. A new section this year is what the impacts of the pandemic have been on the Sunshine Line, and subsequently what the Sunshine Line's responses to the ongoing pandemic have been, and what new initiatives they've undertaken in order to continue to serve our community. The performance evaluation is something you'll see every year. It measures the service quality in relation to several performance measures such as reliability, effectiveness, efficiency, availability, safety, and client complaints. And we'll get into that in a bit more detail here in a little bit. Another major component we do every year is our customer surveys. That includes our door-to-door and the Heart Bus Pass. And this year we have some new recommendations. And then since the designation is coming up this year, we provided a little 5-year overview of the CTC and what some major accomplishments have been. So just to give a bit of an overview of some impacts of the pandemic on TD services, the CTC saw the aging services sites, such as our group homes, close on March 16th and have essentially remained closed since then. Those constituted about 40% of all the door-to-door trips the CTC conducted, as well as pretty much all major group trips have been suspended at the start of the pandemic. I believe the CTC is conducting some small group trips now, up to 3 people, but it's nothing like the group trips they were able to conduct prior. And of course, the Sunshine Line is still considered an essential service, so they were still operating throughout all of this. Trips are needed for medical services, food, employment, and other community needs. Some of the responses they've had to the pandemic in the past few months, a lot of employees have moved to remote work or hybrid. There's been an increase in training for safety measures, including improved sanitation, PPE, personal protective equipment, how to use and when to use. PPE has been provided to drivers to ensure their safety. They're doing a limited number of riders per trip. It was 1 at first during the height of the pandemic, but it is up to 3 currently. And the normal employee screening measures such as temperature and other checks to ensure that riders and employees are safe. And some of the community assistance that's been provided throughout the pandemic, the Sunshine Line has begun delivering meals for aging services 4 days a week. They've been providing transportation for quarantined and isolated clients, especially after positive tests. Additional training for drivers, meeting Chapter 1490 of the state code, and generally improving overall driver performance. And they have not had any service-related cases of COVID among riders or employees to date. So it's been a real robust response from the CTC in response to the pandemic, and they should definitely be applauded. And so we wanted to really highlight that in this year's evaluation, so it doesn't get lost moving forward, and it can be used to support the redesignation as well. So we'll dive into some of the service evaluation metrics. These are ones that are established through our TDSP every year. It includes reliability, effectiveness, efficiency, the availability of services, safety, and then user inputs. So generally, the CTC has continued to meet all of the service standards that have been identified in our service plan. Nearly 95% of trips are not late, with a 90%, our standard is 90%. Our service standard for travel time is 95% of people are in a van for less than 90 minutes, and our performance this year was 96.5. The number of road calls per vehicle mile traveled has continued to go down, which has been a significant improvement since 2016, and continues to improve annually. The number of trips per capita fell just under our service standard for this year. Our service standard is greater than half a trip per capita every year, and we hit 0.45. So this is this fall in service effectiveness is definitely a result of the pandemic. The number of trips have gone down, so of course the number of trips per person have naturally gone down. The cost per trip continues to meet the service standard, and same thing with the number of trips per revenue hour. That is just above the service standard, and that drop is certainly from the impacts of the pandemic on service quality or service availability. Number of vehicles continues to climb. The number of denials continues to drop significantly this year, so that service standard is met. The call hold time also, the service has been met. The standard has been met at 2 minutes and 9 seconds per call. The number of accidents, once again, continues to meet the service standard. This year was just about a half an accident per 100,000 vehicle miles traveled. And the number of complaints, once again, has met the service standard. The standard is under 2 per 1,000 trips, and we had about 0.3 complaints per 1,000 trips. So it's really wonderful to see that the CTC has continued to meet the performance standards that we've established. So I'm going to dive a little bit into the results of our door-to-door customer survey, as well as our bus pass survey. So for the door-to-door, we had about 160 surveys were returned. There's a demographic breakdown that's shown on the right of the customers who responded. So 65% were female, 68% were over 60. 15% of the survey respondents use the service over 10 times per month, and 78% of them use the service for medical appointments. We asked a new question this year on what clients' preferred language is, and we had 14% of respondents responded that Spanish is their preferred language. So we thought that was an important question, and are surprised with the results. And then some of the standards that we had increase, most remain the same. The number of phone calls that were answered promptly, the number of people who agreed with that increased 8 percentage points. And then the automated phone system is helpful. The number of people who agreed with that statement increased by 7 percentage points. And then also as part of the evaluation, we asked a new question on if people feel safe riding during the pandemic with the Sunshine Line, and 99% of people agreed with that statement, which is really wonderful to see. And then just continued, we asked some more service questions. We had asked this question in the past if people, people or their family would go to Pasco or Pinellas County if they had transportation. And prior, we didn't really give them the option of no. And this year we did. So I think that was enlightening. We had 51% of people say they would not travel to Pasco or Pinellas County if they had transportation, but 49% said yes. And the breakdown is here. 26% of people said they would go for medical trips, 20% said they would go for shopping, and there was a few percentage points in other. And another new question we asked this year, as you all know, technology is changing very rapidly right now, and we have transportation network companies and the ability to make reservations on websites and on the phone. So we wanted to get an idea if Sunshine Line clients would like to make their reservations in other ways, but we found that 94% of them said they would like to make their reservations by phone, continue to make their reservations by phone. 4% said website, 2% said a phone app, so that's very small. And the map on the right shows the number of respondents to the survey by zip code. You can see it's primarily outside of the Heart service area, which is to be expected since most people in the Heart service area would be riding Heart. And we'll dive a little bit into the bus pass customer survey results. These are clients that receive a bus pass through the Sunshine Line and who are able to ride transit. We had 563 people return surveys, and the number of people who said that the vehicles are safe and that complaints are handled satisfactorily did increase by 3 percentage points each. In contrast to the 99% of people who said they feel safe riding on Sunshine Line, we only had 84% of people say they feel safe riding during the pandemic on HART. So something to be aware of. And then the demographic breakdown of the responses are on the right. Very similar to the ones for our door-to-door riders, but there was an increase in the number of people who say Spanish as their preferred language at 18%. And then just continued, we asked a new question this year on how people usually get to the bus stop. 78% of folks said they usually walk to the bus stop. 8% said they use a mobility device, such as a scooter or a wheelchair. 3% said they ride a bicycle. 10% said other. So it kind of gives us an idea of how folks are getting there and perhaps what recommendations we can make moving forward for improving bus stop accessibility. And then you can, the number of respondents by zip code to the bus pass survey are shown on the right. It's primarily concentrated, of course, in the HART service area. A lot of East Tampa zip codes and University area is the biggest number. So that gives an overview of our survey responses. Some recommendations we made as part of the evaluation this year are to maintain current service standards and levels, continue to respond to the pandemic in innovative ways that serve the community, such as the meal delivery, the isolation and quarantine support, and other initiatives. And then look towards restoring service to our baseline levels after the pandemic ends. Should definitely be a major goal moving forward. And some 5-year highlights to kind of support the redesignation of our CTC come February. We saw a significant drop in road calls over the past 5 years. That went from 17.9, nearly 18 road calls per 100,000 vehicle miles traveled in 2016 to just over 5 this year. So that took a lot of coordination from the Sunshine Line, increases in funding, improvements in vehicle maintenance scheduling, and so they've really stayed on top of it, and it shows in the performance evaluation. They provided more vehicles for TD trips, so the number of vehicles available has increased, which is to be applauded. The coordinator has continuously and consistently met all our service standards that are identified in the TDSP. And of course, the response to the pandemic has been really robust and fantastic. So they're definitely to be applauded for that. So that's a bit of that's the overview of the CTC evaluation this year. We won't be taking a motion today, but I'm happy to have any questions or comments or discussion, and we'll be looking to adopt this come the February board meeting.
Very good. Joshua, this is Artie Fryer. I'm asking this question because I see how quickly we've adapted to the situation with the pandemic. But with those senior sites being closed, I'm curious if we have any correlation between how many of those meal deliveries were to people who would regularly attend those senior sites. Because I think with the sites being closed, that might have been one of the areas where they did get a meal. And if we've got any coordination or information that shows that we help them continue getting those meals, I think that would be substantial in terms of showing how we adapted.
Mm-hmm.
Artie, the meal delivery was before aging services, so it was for their clients. So they were mainly either people who were already going to those sites or people that that came to aging services during the pandemic. But it was coordinated through aging services, so it was mainly those same people.
Okay.
All right. Shall we go to the status reports now? The first one is going to be TBARDA and an innovative grant.
Yep.
And I'm not sure who's giving that one.
I believe that'll be Chris Jadek over at TBARTA, if he is here and available.
It's a different Chris. It's Chris Dianantis.
Sorry, let me check to see if he's here.
Can you hear me, Josh?
Yep, I can hear you, Chris.
Okay. Yeah.
You see the presentation?
Yeah, I can. So you're going to control it then?
Yeah, I'll control it if that's okay.
Okay. Again, this is Chris Dianantis with TBARTA. Good morning, everyone. Thank you for this opportunity to provide you with information about this brand new service. Next slide, please. TBARTA partnered with USERV, a TNC, on an innovation and service development grant and was awarded by the CTD on October 28th. The primary focus are trips between TBARTA 5-county region, so Hernando, Pasco, Pinellas, Hillsborough, and Manatee. At this point, we do not limit trips based on trip purpose. We provide both ambulatory and non-ambulatory trips. We also provide service during times when the CTCs are not operating. USERV and TBARTA service on weekdays is from 5 a.m. to 10 p.m. and on Saturdays and Sundays from 7:30 a.m. to 7:30 p.m. And the service began on December 1st. Next slide, please. Similar to the CTCs, participants must apply and become eligible. And if you were to go to TBARTA's website, there's a tdtampabay.com link, and you can find the application there. Next slide, please. This is an example of the application that you can find online. It's a fillable PDF, so you can fill it out online and email it, and there's an email address to email it to, or you could actually print it out and mail it in as well. Next slide, please. Yes, TBARTA's role is to provide marketing and has committed funding to the annual report that's required by the CTD. Some of the marketing materials that we've done on media release. We've also been on WFLA. You can see the name of the website right there. We've also sent out marketing materials to all of the CTCs and tailored those materials to each of the CTCs. We've also done some outreach to advocates for persons with disabilities. Next slide, please. If you go to the website, there are some FAQs or frequently asked questions that would, I think, help some folks and that have questions about the service. Next slide, please. And the website is specific to each county because each of the counties have their own requirements to become TD eligible. So a lot of the material is there, and you can get information about that. Next slide, please. This is an example of the flyer that we provided to each of the CTCs, and they've been kind enough to agree to put it on their vehicles so that their customer base can be aware of the service. Next slide, please. We also produced a newsletter that each of the CTCs could use. This one is tailored to Hernando County, but we did tailor them to each of the counties. PSTA uses robocalls, so we actually provided a robocall that PSTA is using. Next slide. And that is the contact list, and I'd be happy to answer any questions you might have.
I had a question, Chris.
Okay.
Have you all had any clients yet? Any trips?
We have. We've had 5 trips. Most of them so far are from Pasco into Hillsborough. We've had a lot of inquiry because the word is starting to get out So we are taking lots of emails and questions about the service. I'm feeling that it's definitely going to grow by leaps and bounds come January.
How's the eligibility? Sorry, go ahead.
I'm sorry.
This is Deborah. I have a question. Will they be using any local providers for ambulatory and wheelchair services, or will it all be in-house?
They use Wave. UServe uses Wave, so I believe that is all in-house.
So
they will. I'm sorry. They will use Lyft for some services. Obviously not wheelchair though.
So the local providers in these 5 counties that normally do some of these that could provide trips, that funding is actually going to go through UServe now. That's correct?
Well, I can't answer that question. I would have to defer to UServe, but I can try to get that answer for you.
I would just, rather than using Lyft or Uber, maybe look at some of the local providers possibly, if they can meet the rates for the ambulatory trips as well as wheelchair trips.
The user does their own qualifications for drivers, so that they have to be drug and alcohol tested, and they do background checks. So it's not your typical Uber or Lyft driver. Just wanted to make that clear. But I will share what you just shared with me with user.
Thank you.
Okay.
Deb, I'll just note that the money that UServe is getting comes from a grant that the CTD had. So it's not any funding that's being taken out of the normal system, but it's funds that are in addition to the existing services that are provided.
Yeah, I did understand that. I would just hope that they would look at local providers to do the ambulatory trips as well as the wheelchair trips to keep, the funding local, and for people that are already currently providing some transportation that may have relationships, so that's just my take on it.
They may be doing that. I just don't know for a fact that they are, so I can't really respond, that they are, but they may already be doing that.
Thank you.
Sure.
I think it's great. Let me just, another note, I think it's great. I think this is something that we've asked for, we've tried to do in this area for forever. And so I think that this is a great service, and I think it's something that's been needed, and I'm glad that TBARDA and UServe have really stepped up. And I know I was in a Tri-County meeting probably a year and a half ago when, we had talked about doing this, and I just think it's a great thing, and kind of a nod to Miss Becky, because this is something she pushed for forever. And so I think that I'm very glad to see this service, and I think it's going to be very needed.
Yeah, I'd encourage you and everyone to please help get the word out. The word is out, but the more we can do, the better.
Yep, we will. Thank you.
Okay, the next status report is TDSP update kickoff, and that's Joshua.
Hey everyone, me again. So I wanted to bring the major transportation disadvantage service plan update to the board early this year. I felt it was important for the board to have an opportunity to help craft this safety list and have some input into the process early on. So I want to just give a quick overview. The Transportation Disadvantage Service Plan is a required product by the CTD that it gets updated every year, and a major update occurs every 5 years, and that coincides with the redesignation of our CTC. which is coming up this year as well. So the plan is jointly developed between the MPO, us, the CTC, and our coordinating board. And it contains development, service, and quality assurance components, as well as information on our demographics, the county profile, what our transportation challenges and needs are, what barriers to coordination there exist within the coordinated system, and other items. And it really guides the service provision over the 5-year presentation of the CTC. Sorry, everyone. And so I want to give a brief overview of what you all can kind of expect over the next few months with the board. So I'm hoping to kick off our major update of the TDSP sometime in January. This will be done through a consultant in coordination with us in the Sunshine Line. So I want to make clear that we have 2 TDSP updates coming this year in 2021. We'll have the minor annual update, which will come to the board in June. And then in August, we'll have the adoption of the major TDSP. And I know that's a little weird. It's 2 months in between the adoption of 2 different TDSPs. And the reason for this is really the timing of the grant cycle and the redesignation of the CTC. So the annual update is occurring at the end of our grant cycle, which is why it backs right into the major TDSP update in August. So the minor update will be, like I said, a minor update. It'll have a few items that are changing. And then the major one will be essentially a whole new plan in a way. And I think moving forward, I'm hoping to eliminate this kind of strange back-to-back adoption of the TDSP by moving the adoption date to August moving forward every year. And that'll put it at the beginning of our grant cycle so that when the redesignation comes up in 2025, we won't have this, or 2026, we won't have this back-to-back again, which can get a little strange and confusing. So just an overview so we're clear. I know I didn't want to come in June and then come back again in August and be like, well, didn't we just do this? We did, and this is kind of why. So some TDSP components, just what's included. It's an overview of our service area, what the history of the CTC is, how our service aligns with other planning efforts going on in the county and in the region. We do a service area profile looking at demographics and land use and where people are going and where they're coming from and what services are available for transportation in the county and in the region. We do a needs assessment, forecasting TD population into 2045. We do an overview of what barriers there are to coordination within the system. There's a section on goals, objectives, strategies for improving service. And then, of course, we have our operations and quality assurance components. And the areas that are italicized, the needs assessment, the goals, objectives, the implementation schedule, are required components for the minor update. So that's kind of what you can expect to change from last year come June. But come August, we'll be taking a fresh look at all of these areas. So I wanted to open up to the board. I'm going to go through individual areas that are listed here. And I'm hoping we can get some input from the board on each area to help kind of inform the scope of the major update moving forward. So feel free to jump in at any time and provide your input on the individual components. So I'm hoping for a little bit of discussion. The first thing I wanted to kind of talk about was available transportation services. Right now, we recognize, of course, the Sunshine Line, our public service providers, such as HART and PSTA, as well as our coordination contractors. So agencies such as Angels Unaware and BOLI centers, companies like that, organizations like that provide services. But of course, we've had a big change in the transportation environment over the past 5 years. We've had the advent of transportation network companies, just Uber and Lyft and User. And so I guess I want to ask the board, how do you view transportation network companies such as these, or such as User, which you just heard from, and TBARTA, within the coordinated system, and what concerns do you have as well?
I mean, in terms of private vendors like Uber, Lyft, and I'm not familiar with UServe really. You always have the long-standing issue of profit over quality, and that's something always to look out for. And that's usually my major concern. They have slightly different goals than something like us, where we're trying to deliver a quality of life, whereas they're trying to make money, and there are ways of doing both, obviously, but it's just always a caution. They're not always the same thing, and so that's the main concern I have when these things come up.
This is Dr. Gordon. I totally agree with Glenn. Sometimes it's even profit over safety. So that's another consideration that we often have. But I mean, we're in a whole new world, and I guess we should make other options in terms of transportation a possibility.
Yeah, I hear you. I think that's kind of what I've heard from a lot of board members and from the Sunshine Line as well. And, so I wanted to bring it to the board just to have a short discussion on it. And, I think it's important to acknowledge their existence, but have a healthy skepticism of how their goals align with our goals. So definitely noted.
Hi, I was going to ask about how do we expect bike share, scooter share, and so on to really be part of this? My understanding generally is that people with diminished abilities are basically the heart of the ridership here. So it sounds like it doesn't seem to fit.
Yeah, I hear where you're coming from. I think they mostly fit in with maybe the bus pass users, folks who are walking or biking to the bus stop, that kind of area. Definitely not for our door-to-door riders, for sure. But I think just acknowledging them was kind of the intent of including it. Yeah.
This is Mike Lacey from APD.
Yep.
So we've worked with UServe pretty extensively in the past, and what I would say our most common complaints was kind of their scheduling system and how difficult it was to schedule routine things. Like if, say, I know if this is going to be cross county now, but if that's known every single week or every other week, it was very hard to schedule ahead of time. That being said, the responsiveness was much more, accepted and championed and applauded than whatever difficulties they had with the scheduling for those types of companies and how they have difficulty with that. The only other issue we encountered is sometimes we'll compensate folks if they're on various plans for their transportation, and things like Uber, Lyft, UServe do not give physical receipts that the state requires for compensation. So that was another concern, but that's very rarely that comes up. So I would say the benefits greatly outweigh whatever kind of issues come up from that stuff.
Thank you. Any other points on this one? So another major section I wanted to talk about was kind of our needs assessment. Right now, our needs assessment primarily focuses on access to employment and healthcare, shopping, all these major areas. So on the right is a breakdown of all the trips in the coordinated system and what the trip purposes were. You can see about a quarter are distributed between nutritional, medical, and life-sustaining. We have some education and training that almost constitutes a quarter as well. And employment is about 8%. And of course, we have a discussion on regional needs. which of course, while we have this new service, there's still a lot of them. So I think moving forward, just kind of curious how you all have viewed how you all have seen the needs evolve over the past few years, if we have any new challenges in service provision, and then if there's any impact on needs as a result of the pandemic. Of course, a lot of the needs remain the same. You know, people have to get to where they want to go. So. All right, if there's no discussion, I'll move on this one. And then kind of continued on the needs assessment. We did look at this. I took a fresh look at the breakdown of different demographic groups and who is taking trips with the Sunshine Line and across the whole system. One thing I pulled was the number of children at risk that are being served throughout the system. The Sunshine Line did not provide any trips for children at risk, and then our coordination contractors, of all their trips, about 0.7% was children at risk. For older adults, that was a little bit more than half of our trips were older adults, and there's a lot of overlap there. As was previously stated, you know, we have older adults and persons with disabilities as well, and the breakdown is a little bit more nuanced. And then, of course, you know, older adults, low income, and disabled, that was 34% of all trips. And then on the right, there's a bit of a demographic breakdown. You can see dot density of persons with a disability across the county, so you can get an idea of what the concentration is. And I'm hoping to see if you all have any experience and insight into any groups we might not be reaching, particularly children at risk. Maybe Glenn or Beth, if you have any insight on that as well.
Yeah, thank you for looking into the children at risk group, by the way. Appreciate that. You know, a part of me, just my gut feeling is a lot of families or minors and unaccompanied youth may not be aware of what's available to them. That may be part of it as well. Plus, it's might be, you know, I'm thinking about families that have limited transportation and young children and need to do trips while someone else has to use the car for working and that sort of thing. What is their eligibility? Can they get on board with it? Is it available to them? How can they access it? So probably just information getting out, I think, could be helpful, but that's what my gut response is. I don't have data to back me up on that, but I do know of a lot of families that are challenged with transportation, especially with some of these housing issues that are coming up where they have to make some decisions on how to get to appointments and get to shelter and that sort of thing. So, but I'll let Beth speak to anything if she can think of anything.
Beth, you might be muted. You're self-muted, I think, still. Sorry, Beth. Try again, one more time. Sorry, Beth. Oh, there you are.
I'm unmuted now? Okay. I agree with Glenn. I think one thing is really getting the word out so that folks know, and especially with COVID, with more kids home, you know, trips, there are more trips, even to medical providers, sometimes even daycare, that I don't think that population maybe has all of the information. So maybe it's just targeting and getting the word out a little bit more.
I think one of the conversations we had with Sunshine Line is there's a possibility that a lot of the needs are being met by other social service organizations as well. So that was one thing, but I think perhaps there's room for some more targeted advertising.
Yeah, I think it's more the targeted, and some of those agencies probably should look more at what they can make available to some of their clients. Certainly, that's always the case. But I think if some of these families knew the level of quality and service they could get from Sunshine Line for some of these appointments, they would be thrilled. You know, the Scott's crew does a great job.
Yeah, I think it would be utilized more if they knew about it.
Josh, is there a reason that we lump the older adults, low income, and disabled together, the 34%?
That was just to give an idea of the intersectionality of some groups. Right now, the way that Sunshine Line has to report to the CTD is only one characteristic. So if you were to look at our operating report, they report, like, if someone is both an older adult and low income and disabled, they would only report one of those characteristics. And so I wanted to highlight that a lot of the trips they're providing are to folks who have kind of who intersect on this TD criteria. Does that make sense?
Yeah, I get it. But in presenting the data, I mean, somewhere we need to make clear like what the percentage of disabled versus older adults, right? You know what I'm saying, separately.
Mm-hmm.
Yeah, I think that presents a cleaner picture of who you are serving.
Okay.
And I think one of the need assessments need to be for the young adults, disabled young adults that after high school maybe go out on their own. The transportation is difficult for them. I'm currently transporting somebody that, you know, I'm trying to support him in different ways, but I think that needs to be looked at as well. They're not falling into some of these categories we have, just as the previous speaker said, that we probably need to look at a different group that may be underserved, you know, those 18 through, you know, 60 that are the underserved population. And my specific was like 18 to 25 or 18 to 30, but I think we need to look at that.
Wonderful. Thank you, Deb.
The other thing, I don't know, with some of these assessments, I've been a foster parent for a long time, 9 years, and I know that through the foster system that they do their own transportation. So there's a lot of need for foster kids to get to high school, to get to middle school, and even transport to daycares. I don't know if we can just show that we are doing that in our community through some of these, the big foster agency. It used to be Eckerd, now it's changed hand a little bit, but you know, maybe some of these numbers we need to show that we are providing some transportation to this population of children at risk, and who is doing that transportation. I don't know if we're showing that, but you know, those agencies as well need help. So it's just something else I wanted to put out there.
Thank you, Deb.
Actually, to Deb's point, that age group she talks about does face a lot of challenges as disabled folks in that category tend to fall off their parents' insurance, and there's this sort of gap. It's a little better since they've changed the laws, but you know, there is that sort of gap in service for some of these folks as they reach adulthood.
Yes, especially the 18 to 24 group.
One other thing sort of related to this and the whole plan here in general, I don't recall seeing that we ever ask about official ride share or just friendly neighbor, friend to friend ride share anywhere in our surveys. And it seems like that could be possibly a little piece that would be interesting to know about, that we could ask on you know, later surveys.
Yeah, I think maybe as part of the evaluation, or even for the public involvement for this, we could see what percentage of trips are provided between these providers, but also for friend to friend kind of idea.
Yeah, I mean, if it's a needs assessment, I definitely think that's something that you would want to explore. We did a transportation assessment for our WIC participants and discovered that a lot of families travel using the car from other family members. So there's a lot of borrowing from other family members. So there are real transportation challenges, but they are doing the best they can, borrow, whoever's car to go wherever they need to go, doctor, WIC program, hospital, whatever. And so it would be good for us to fully understand that challenge for our group.
Okay.
Actually, to everyone's point in that as well, that gives you an interesting sort of other dynamic at the Planning Commission on civic engagement and civility in communities and neighborhoods as well, as it would fit within that sort of category also, just as an interesting measure to capture. But I don't want to take us off the importance and topic here.
This is Gloria. Was Scott Clark supposed to speak in the status reports?
Yeah, I don't think we're quite there
No?
yet. I think we're still on this item.
Okay.
Yeah, we're almost there though. Is there any other thoughts on the needs assessment? Any other groups we should try to cover, everyone? Okay, got a few more items. So service limitations and some barriers to coordination. Right now in the service plan, some of the service limitations that are identified currently are our communication between our contractors, which really represents an opportunity. Our funding for public transit services, which is kind of hard for us to really influence too much. The bike ped network and how people are able to get to bus stops, as well as our land use and low density development patterns. Those are all current challenges we have in service provision. And I wanted to kind of open it up to see if there's any other barriers and service limitations that you all see. Some areas that we talked about was safety in the context of the pandemic, in terms of access to bus stops for our bus pass users, as well as door-to-door, people who get dropped off door-to-door who might need to get around in a shopping area or something like that, what the related safety is there. Of course, the transportation network companies topic is going to keep coming up a little bit. Just what you all talked about briefly already, some of the shortcomings of those services, so something to include in there. Our coordination with HART on electronic bus passes is one area that we had a discussion with Sunshine Line on recently. And I wanted to see what other barriers you all recognize and what other opportunities there might be in improving service as well.
I think one of the biggest barriers for some of our folks is trying to get to the bus stop, the last mile. I worked in Pinellas County for a long time, and they had a program where they had a provider take the client from the door to the bus stop because it was within their, the first mile, last miles, I think is what they called it. And that way the person could actually get onto the bus to go where they needed to go. But for some of our folks, they can't cross streets or they can't cross some of these major roads that we have. So I think that would be something if we can look into something like that. And they already have the process, and they've been running that system for a while. So I think that would be good. And also maybe some late service, some of the folks that we transport, the service ends, so they, Pinellas County also had I think they got a sandbox grant. And what they did is they did like overnight transportation, and they paid for it because their bus service wasn't running. So they did like an overnight from, I want to say, from the time their bus service ended from like 10 p.m. to 6 a.m., they had like a service. I think they use Uber, I think they use Lyft, but those are maybe something we can look to if there's grant opportunities.
Yeah, I think they did use Lyft for that late night service outside of their outside of the bus PSTA hours. So
Yeah, and also I think they used it for the first mile, last mile, they called it. That was a really good program as well. Just help people get to the bus stop versus using Heart Plus.
wonderful.
Joshua, under communication between coordination contractors, you have that as an opportunity. Would you be willing to include not just communication between coordination contractors, but communication and the community? Because I think there is work that still needs to be done in terms of sharing what resources are available. So I think communication to potential users or members of the community is also another opportunity that should be considered.
Definitely. Thank you, Dr. Gordon. I agree. Okay, I'm going to move on. So I wanted to give an opportunity to see if you all would like any particular service analysis, maps made, any other figures, or anything that would be a bit more data intensive. Right now, some of the figures that we include are the destination of Sunshine Line clients, the number of trips that are taken by zip code, looking at stuff like what's the relationship between our low-income census tracts and our transit service, what our sidewalk coverage is in certain areas and how that relates to our ped crashes and our destinations for our clients. So the map on the right shows TD destinations, Sunshine Line client destinations, primarily concentrated within the city, but you do have a lot in the city of Tampa, but you do have a bit in Plant City as well as the Brandon area and a little bit down in South County. And these are a few of our other maps that are currently included. TD origins by zip code, like I said, the low income census tracts as it relates to our local bus services, and then this crash hotspot in relation to TD destinations. So just seeing what you all would like to be analyzed. Some thoughts I had was some more detailed ped crash analysis, specifically as it relates to persons with disabilities. Some further demographic analysis we're doing. You all heard at our last meeting about the non-discrimination plan update, so I think there's a lot of opportunity to include some of that demographic analysis into our current service plan. But if you all have any other ideas, we're happy to explore them as well. All right. If there's no other thoughts on that one, I think I have one more item regarding community involvement, which aligns well with Dr. Gordon's suggestions. We do have an opportunity to do a community involvement effort relating to needs assessments and barriers and any other items. So in the past, we've had our coordination contractors roundtable, which occurred last year. We can look towards doing that yearly. And we also had our Human Services Transportation Forum back in 2016. I wanted to see if you all would like to repeat any of these, if you have any other public involvement efforts that you would like to see, and what organizations you'd like to have involved as well. Oh, sorry, Mike.
Howdy. So I actually wanted to, for what we could be tracking, would it be possible to track where ADA accommodations have been implemented?
I think so. I can look into it. I can coordinate with the city and see what kind of mapping they do and what data they have available. I assume you mean stuff like curb cuts and like sidewalk ramps and detectable warning.
Beeping crosswalks and that kind of, yeah.
Yes, okay. Yeah, I will look into that.
Yeah, thank you.
Yeah, thank you, Mike. Are there any other thoughts on community involvement? What you all would like to see as part of this plan update? Okay. Well, given that, if there's any other items to discuss as it relates to this, anything you all would like to bring up, feel free. I'll be working with the Sunshine Line and our consultant to put together a scope this month. And we're hoping to get that started in February at the latest, if not January. And then you can all look forward to having that come before you in August. So, and with that, Gloria, I'll turn it back over to you. Sorry, Gloria, you're muted. You should be good now.
I'm muted.
You were. You're good now. Go ahead.
Okay. Are there any on old business and new business? There's a section in there.
For our quorum requirements, everyone, just to give you a quick update, that did go before
about
the MPO.
quorum.
Yep. I can provide a quick update on that, Gloria.
Okay, great.
We had our quorum update request come before the MPO board at the last meeting. So it takes 2 meetings to have a bylaws amendment pass. The first meeting is a hearing, and the second meeting is the approval. So we're shooting for approval at the January board meeting, and that will reduce our quorum requirements to 5 for our February board meeting. And so with that, we will need 5 people to attend in person on the 18th floor of the county center in February. So if anyone is willing and able to do that come February, please message me and let me know. We do have a lot of safety protocols in place, of course. There is temperature screenings at the door. Masks are required in the building at all times. There are shields around each seat in the room on the 18th floor as well. And we do have laptops or surfaces available for board members to use that attend in person. So it will be a hybrid meeting. But I think we've gotten most of the logistics and challenges of running the hybrid meetings worked out with a few of the other boards. So we should be good to go. Yeah, that's it. If anyone has any questions on that, please let me know, or any concerns.
Okay.
But we should be good.
All right. The next meeting will be on February 26th, I believe.
Oh, so sorry, Karen. I apologize. Gloria, I think Sunshine Line has an update.
Oh, Sunshine Line, we missed. I'm sorry. I thought I said Sunshine Line. Please come on, Karen.
Okay. Hi, yeah, Scott is not here today, so I'm going to give the update. Some of the things that we're going to update you on were kind of covered in the discussion of the evaluation, but just to let the board know, we're still, I mean, obviously we're still providing service and we're doing it every day. But we're still providing about 1/3 of what we normally provide in door-to-door service and about 75% of bus pass program. We are trying to make sure that people are still aware that we're out there. So we're trying to do some outreach, which is hard to do at this, in this current environment, because we normally go out to events in the public. So if any of you can help us make sure that people know for your population, the agencies you work with, we're really trying to make sure that people are still applying for our service and still know that they can get transportation. If we can't provide it, we'll help them find someone who can, but we have the resources. We just want to make sure people still know. So your help is appreciated there. We're still doing Saturday service, so if people are maybe not comfortable going on a day they think is going to be busier, we're doing Saturday service, and it's creeping back up to about where it was last year when it started to drop off, so that's good. We're the meals that we're providing for aging services clients, that service is actually going to end at the end of this month because it was a CARES funding funded project, and that funding will go away at the end of the month. But we've been providing about 1,800 meals a month since the middle of June, I think it was. So January, there will be a new program for aging services clients, and they'll be doing grocery delivery. So that's also funded through different CARES funding. So that will, I think, kind of take over from, instead of hot meals, they'll be getting groceries, but just to serve that same group of people. Meals. Oh, we're trying to make sure that we're working with community groups. So we're doing some things with metropolitan ministries if people are, going there to get either holiday resources or other resources, where we're even helping make sure that our clients are aware of it. We're helping enroll clients who need to go there to get services rather than having to just refer them to metropolitan ministries. We're going to collect the information enough through customer service to the kind of fast track the enrollment process with them, or the registration process. I think that is about all of our updates, but just seriously, if any of you can get the word out, everything helps. So
Thank you.
Madam Chair, I think we're next meeting.
Next meeting is February 26th. And then we have an addendum.
Yes. So in your agenda packet, there is an addendum on the MPO meeting summary and the committee reports from the past few months for anyone interested. And I think that's it, Madam Chair.
Okay, well then we're adjourned. Thank you.
Thank you, everybody. I appreciate it.
Have a good one.
Have a nice weekend.